Welcome to Building the Best You, a destination for you to reimagine what is possible in your life and then create it. Welcome, everybody. I'm your host, Jeanne Collins, and today we are talking about spinal health. Today, coming to us from California, we have Dr. Brigitte Rozenberg. I am excited to have her on the show. We're going to talk about something that I don't know a whole lot about. So I'm going to learn, just like you guys do, about spinal health. And one thing I know, being a woman in menopause, bone health is so important and physical wellness is so important along with our strength. And our spine is at the center of it all. So I am so excited. Welcome to the show, Doctor.
Thank you for having me, Jeanne. I'm excited to be here.
I can't wait. So before we dig into all the details of everything that you do, and you can educate us all about spinal health and all the things that we don't know that we must know as women, can you share a little bit about your background, about how you got to have your own practice and do what you do?
Sure. I'm a chiropractor. I've been practicing for about 30 years already. Can't believe it's that long. My mother was a physician, so I was always drawn to medicine as something that was innately embedded in me since I was a child. I wanted to go into medicine. And, I came here to go to school, to go to college. And when I myself had some injuries, I went to see a chiropractor and, I had some treatment and I really enjoyed the interaction. I enjoyed the medicine that he was treating, that it was kind of like medicine without really medication. It resonated with me. I always wanted to be a doctor. And I thought, okay, so it's either I'm going to do something like this or I'm going to go into more like emergency medicine. I have to choose which one I want to go. But it was something about this profession that really drew me into the connection with people, helping them a little bit less invasive. So it felt just it was just an easy, direction, kind of drew me into that profession. Someone once told me that you don't choose the profession chooses you. And I really truly now, 30 years into the game, I feel that this is exactly what happened to me. I enjoyed it. I liked it. It was, I came here to this country to go to school and I felt like, there was a chiropractic university in my city. It was everything kind of aligned for me. So I felt like, okay, well, that's where I need to go. And here we are today. And I love it more. I think even a little more than I did when I first started, because, you mature within your career and you have better understanding of different things and you can bring more quality of care and knowledge and then the advancements of everything that's going on. I really do love it. I feel like this was meant to be for me.
Ooh, and I love that. You're where you're supposed to be and in your purpose. We're going to put in the show notes how everybody can find you, get in touch with you, go visit you. You have multiple locations. I've been to a chiropractor before, and every time I've gone to a chiropractor, it kind of feels like a little local doctor in a little office. Your business is far from that. So can you share with everybody what your business does? Because it is not you in a little office with one table.
You're absolutely correct. And I think that this is what I meant when I said that I meant to do that. Chiropractic is, you have them in every corner in every city, and it's a little office, can be in a strip mall or in a medical building with one chiropractic table, you get adjusted. And for me, it's a completely different game. I am a disc and spine specialist, meaning I offer treatment that are alternative to back surgeries. So in my world of chiropractic, we offer and I put together a treatment plan that can help patients avoid surgery, especially if they're dealing with a very serious condition like herniated and bulging disc. So I'll take it a step further. In the chiropractic realm, you can do regular adjustments, just, go to the same chiropractor as you just mentioned. You can be more inclined to do functional medicine or nutrition. You can be a chiropractor that specializes in treating children and pregnant women. Or you can be someone that specializes in treating sports injuries and trauma-related injuries, which is something I kind of like, that's where my career took me. And then you can have the subspecialty of being like a spine and disc specialist that requires a lot more work and a lot more, credentialing and certification and, kind of understanding that area deeper. And I feel like this is where I fell. All my career, I work with patients after trauma. I treated patients after car accidents. I treated patients after work-related injuries, sports. Like that was it was more trauma related. And I think this is where the connection is to medicine, from my
Yeah.
mother. But then over the years, I was, exposed to all the new technologies and techniques and different things that are available today that maybe many years ago were not available. And I put it together and I'm like, this is great. I mean, people are looking for different solutions and here I am. And I created this incredible spine and disc center that offers alternative to surgeries.
Okay, I have so many questions about alternatives to surgery. So
Go ahead.
first and foremost, okay, I understand spinal surgery. Totally get that. I understand herniated discs. I understand things being out of place and getting them back into place. But sometimes, like degenerative discs, for example, how, without surgery, are you able to help someone with that condition?
So, great question. So, there is a big spectrum of degenerative disc disease and disc conditions, and there are certain scenarios in the degenerative disc condition. We call it, it's not really a disease, but like a condition that you can't reverse even if you have surgery. There's just no way. Once it's degenerated, it's degenerated. You can just fix it to a certain extent. But we have in today's world a lot of different technologies and different modalities. And all these modalities, if you're combining them together and you know how to use it correctly, can really help you reduce the pain and reduce the symptoms that are associated with these conditions. Because what happens when you have, let's just talk about like herniated or bulging disc. So when you have a herniated or bulging disc, a disc, just for me to explain a little bit, it's like a cushion between two bones in the spine. And that cushion has a lot of water. So I always explain it to the patient. Think about it like a sponge with water, similar to the sponge you wash dishes with,
Hmm.
has a thickness. Or think about it like a donut with jelly. And
Yeah,
so what happens when it's degenerated, it's like the sponge gets dehydrated. And when you put water in it, it expands.
sure.
With the donut and the jelly, you press on the donut and the jelly kind of comes out. So
Yeah,
those are the little analogies that I explain to people. And with wear and tear and injuries, you can have a sponge dehydrated or you can have a donut that the jelly is coming out of it. So there are a few ways to fix this. You can fix it with cutting this little jelly out with surgery, or you can fix it with doing certain procedures like non-surgical spinal decompression, like, using laser therapy, soft wave therapy, and all these different modalities that help regenerate the disc back and help your body heal itself. Because the research have shown that, and I'm talking specifically about a disc because that's where normally patients get, that's why people will, be offered to have surgery. If they have a
right.
disc disease, degenerative disc disease or whatever, they're going to be offered surgery. So the research has shown the disc is a dynamic structure that can heal itself if you provide it the right environment. So in order
Oh,
to provide it the right environment, you need to have the right tools. And with the advancements of medical technology, we can achieve all that. Now you just have to take all these tools and put them together. And
uh
so that's what
huh.
we do.
Ooh, and that is so beautiful. So I'm guessing someone comes many times, like a series of times, in order to be able to help your body to be able to regenerate what it needs help to regenerate. Is that correct?
Correct.
And it's not just like, I'm going to adjust your spine to make it more in line. It isn't about that.
Not at all. Patients with what we call in our world a hot disc, like when the disc is like severely degenerated or severely herniated, it's very painful. And we don't adjust those patients because it's just too painful and it's not safe.
Right.
So, what we do is we have a protocol that I created, and it involves using a system called non surgical spinal decompression. And it's using laser therapy and using different modalities that I can list them all to you. And what I did is I created a treatment plan called Advanced Spinal Restoration Treatment. That is a treatment plan that encompasses multiple modalities and technologies done used on the patient, done in a systematic way. It's like a recipe
Sure.
and in a very specific cadence and specific frequency. And when you do that over a period of time, you allow the disc to regenerate back to a certain extent, which will allow the patient to have a lot less pain and function without any limitation. And then they don't need surgery. And that's how this kind of works.
which is beautiful. And I love the fact as you're speaking, you almost remind me in some ways of functional medicine because it's tapping into different modalities to find the right modality to tap into the root cause of the problem and layering things on top of each other in order to help your body be in the best position it can be to heal itself. Am I accurate in how I just said that? Because that's how it feels on my side.
That's exactly what it is. You allow the body and you give it the environment so it can heal itself because, the body is miraculous. I give examples because to me, people accept or deny care based on logic. If
Mm,
you are logical and you give them clear explanation that makes sense, then it makes sense. People have to understand. Now, I understand that if you're not in the healthcare and you're not a doctor, there's certain language, or vernaculars that are used that people just don't know. But I try to make it extremely simple and very basic. And so that's why, that's how they either accept or deny care. So I'm
yeah.
explaining them exactly like imagine you have a cut. Your body is able to heal itself. The cut is going to heal on its own. Maybe you need to stitch it or put a band-aid or whatever, but it will heal. A
Yes.
broken bone, the same thing. The broken bone is going to heal as well. You just have to put it in a cast because if you're not going to put it in a cast, it's going to heal wrong. But if you will, it may heal, right. So
Right.
those are the examples that I give to my patients.
Yeah. Which is so true. Now, let me ask you this. In the world of quick fix, right? Because as much as we hate this, we live in a society that wants everything and we want it all now. And no one has any patience for the long game. How long does it typically take a client until they can start to see baby step improvements so they really get committed to the longer journey?
So it all depends on each patient, meaning how long they've had a problem.
Mm,
So if a patient comes in and says, I went to the gym and I lifted really heavy weights and I hurt myself, or I was moving a box and twisted, and now I have pain radiating down my leg and it's been like this for 2, 3 months and I can't get rid of it. That's a different scenario than if someone comes and says, I've been in pain for 20 years. I've tried
uh,
all these different things and I really don't know what else to do. So if you had a problem for 20 years, you won't be able to fix it in 2 visits or 3 or 4. If you
sure.
had a problem for 3 months, it may not get fixed in 1 or 2 visits either. The way you fix serious conditions like a herniated disc or a bulging disc and a pinched nerve, you need to give it time. So
Mm,
we have patients that with certain modalities that we use will feel relief pretty immediate. And we have patients that will need few visits to feel better. But all in all, I mean, it takes a little bit of time, but it depends on you individually or how fit you are and your health condition. You can feel better pretty quickly. Like if you come in with a pain level of like 9 out of 10, there are certain treatments we can perform and you can leave with a pain level of 6 out of 10, not 2, but
yeah.
6 or
But six,
maybe
yeah.
5.
9 down to 6 is pretty impressive.
Correct. But it compounds on itself. So the more you do, the better you're going to get and the more it's going to stick,
Right.
as we say.
Sure. Yeah. Now, do you also help your clients or just in general knowledge for the general public in ways to improve your spinal health, either after the injury or before the injury to prevent yourself from injuring yourself in the first place? Are there things that we can be doing?
There's always things that we can do. So we definitely talk about your lifestyle. It depends on the patient's lifestyle. Some people have a job that's a lot more physical that requires prolonged standing or walking or lifting. So we definitely give you lifestyle tips and work tips and postural, correction. So basically, it depends on patients' lifestyle and what they do and what kind of work they do. So we give them instructions of how to do things better, correct their posture, kind of pay attention to the way that they walk, the way they go up and down the stairs, things of that nature. And then once they're done with the treatment, and then they want to say, okay, I'm done with my treatment. I feel great. What can I do to prevent this from happening? We again educate them on exactly what needs to be done. What do they do every single day? What activities are they involved in? And if they have a chronic problem that we just finished fixing, then we keep them on a maintenance program where they go back to their normal lifestyle. But then, like once a month, they'll come in, or once every 2 months, they'll come in to just make sure everything works well.
Makes sense. I'm guessing you probably still have patients of all ages. However, I would think if I had to guess, there are probably more women than men and more women in mid to later in life than when they're younger. Does that
That's
sound
true.
about right?
Yes, we do get a lot of women, and especially I am in the age of menopause myself.
Yeah.
So, I attract a lot of women that are very similar to me in age. And normally that's the time where you kind of feel like, okay, I need to be really active. I need to exercise. Let me do a little more pickleball. Let me do more things that I've done before. And that's the time where it's like all of a sudden, oh my God, I can't do this. And I thought I was able to perform all these activities, and now I have more pain and all these limitations, and I don't want to age prematurely.
Yeah.
So, we see all of those across the board, but it's not different treatment for men and women, although we have few things that are a little different. It's just a different approach. Women are a little bit more proactive, and they want to take care of themselves, and they want to fix the thing. And men is like, oh, I'll be okay. It's just going to go away until they just cannot walk anymore. And then like, why
Right.
did you wait that long? I said, oh, I thought it's just going to go away.
Oh my goodness. So, what do you do for yourself personally so that you can be in good health in order to be able to help all these people?
Well, first of all, nutrition is very important because, we all know that food is medicine. So
Mhm.
I'm very big on eating healthy and eating clean. I work out. I should work out a lot more than I do because I'm very busy working and running 3 practices, but definitely exercise. And, but I want to tell you that all in all, with all those physical and nutritional elements, I feel that the most important thing is your mindset. And if your
Mm.
mindset is right and mentally you're like in a good place, or you work on yourself to be in a good place, all those other elements are going to fall into play. I see people that are very health conscious, they work out, they eat healthy, but their mind is emotionally and mentally they're just not in the right space. And all of it is almost not even worth it if you cannot emotionally and mentally feel aligned with yourself. And I
Yes.
see that a lot in my practice.
Interesting. And I love that you say that because I would think living out in California, I feel like California is a little progressive. I feel like people are spiritual, they're woo, they're into mindset. They understand the mind body spirit connection. So the fact that you're seeing that people should focus on that more than they do or how important that is very telling to me for the rest of the country where it isn't necessarily as mainstream in some other places where the importance of mindset and how you feel emotionally, because that impacts your nervous system. Everything has to impact your spinal health and your strength if it's impacting your nervous system. If you're all like tense and anxious, that can't be good for your spinal health either.
Very true. So what I see is that, and I see a lot of patients in chronic pain. So they can be healthy and fit and all of that and look great, but when they're in chronic pain, that affects their mind. It's a completely different, it's a different ball game. So the thing is that you can be in a place that's very progressive like California, and you can be in a place where people think that everything is good in mindset and let's meditate and all kumbaya. But if you live, because that's what I see patients in chronic pain. If you live in chronic pain, all of that stuff, even though you really know it, it's very difficult to internalize it because you just live in this kind of like mental place where you're constantly you're constantly in pain. So
Right.
that almost becomes who you are, and it kind of takes over your identity. And I'm saying all that is because that's what I see. Those people that come to me, they come to me because they're in pain. They tried it all. They meditate, they do yoga, they do all of it. They eat healthy. But if you have a mechanical problem that is not being fixed, which is exactly the world that I live in, and
Right.
you're in constant limitation and you cannot perform the normal activities that you want to perform, then that takes over and that puts you in a different state of mind. And that's where I make the connection between the mind and the body, because those are the patients that I see. They're just in so much pain and there's so much limitation and they've tried so many different things. They cannot overcome it. And I have
Yeah.
patients that say, I don't want to be on the medication that they're giving me. I control my pain with meditation, and I control my pain with doing yoga or walking on the beach and kind of doing all these different things, which is very good. But if you don't fix the core issue, which is the mechanical, problem, then all those other elements they don't work. And you almost get like,
Right.
but I'm doing all of that. How come it doesn't help me? And like I'm
Right.
meditating and I'm thinking positive and I'm
Yeah.
lighting candles and which is all wonderful, but you need to fix the core problem in order for all those other elements to work. Like it doesn't work. It
Right.
has to work together. Does
Sure.
that make
Right.
sense?
You still have a broken bone. It doesn't matter how much you meditate or sit on a mat. It's like if you go back to the broken
Exactly.
bone analogy, you still have a broken bone that's not healing correctly, even though
Exactly.
that's not exactly what it is, which is interesting. Obviously, for people who live in California, we're going to post in the show notes how everybody can find you. They can go and see you in person. But for the people who don't, I would love to be able to share with them if they think this concept of a chiropractor, of this concept of helping their spine without surgery is interesting to them. How should they go about doing some research where they might live to try to find someone who might be like you somewhere else in the country?
Well, that's a great question because I think that the biggest search is you need to find a chiropractor that specializes in alternative to back surgeries. If you live no matter what part of the country you live in, and you suffer from degenerative disc disease, herniated or bulging disc, spinal stenosis, you have difficulty walking, you have sciatica, and I'm talking about all these conditions because those are the conditions that I see day in and day out, then
Right.
you want to find a doctor that doesn't do just traditional regular chiropractic work, but actually someone that implements and utilizes technology such as non-surgical spinal decompression. Non-surgical spinal decompression is the backbone of the advanced spinal restoration treatment. It's a system that's computer generated. It's a table that we put a patient on, we program the treatment in, and we decompress and stretch the spine in such a way that we allow the disc to heal itself and kind of be sucked back into place. It's a lot more, physiologically, how should I say that? There's a lot more explanation that goes into the treatment,
Yeah.
but that's the main concept for those patients that suffer from pain and have those different conditions. They want to find a doctor that specializes in these treatments because those doctors would be trained and will have the equipment and the technology to use on those patients, and that's going to be the element that's going to help them get rid of the problem. Does that make
Okay.
sense?
Yep. Makes perfect sense.
Okay,
Yes. You
good.
gave some very specific keywords that people can go and look up when they're on their search. So it's not just a blanket Google search. So thank you so much.
Sure.
So before we run out of time, I have a couple questions for you. I would think in the land of technology is advancing so quickly, and medicine is no exception. How do you stay on top of everything that is out there for you from a technology perspective in your specialty and in your field?
I think that that's a great question because things move so fast. You almost can't keep up with all the changes that are happening. So,
Yeah.
especially I want to say that in the last between 5 to 10 years, especially in the last 5 years, things have just exponentially transformed. And I think that you just have to stay open and, be go to all the different conferences, be open to receiving all the new information. And when you're invited or you know that there is like a conference about biohacking or health and wellness and aging and health span, lifespan versus health span and health span, you need to go as much as you can because you will find all those new elements that you never even thought existed. And just the thought, healthcare is changing so much. What used to be normal and common 10, 20 years ago is completely shifted. And even in the chiropractic world, when I started 30 years ago, it was a little bit out of the mainstream, and that's the reality. That's what it was. But
Right.
today, it's a completely different game. And I can say that I saw a huge shift after COVID. COVID
Mm.
kind of was the breaking point for how the general public perceives medicine and healthcare. They're looking for different solutions. They're smarter. They don't just trust anything that someone just tells them. They'll do more research, with AI and everything else we have going on. There's a lot of information, and people just become a lot more educated and they just don't accept the status quo anymore. They're like, well, I'm going to do my research before I make a decision. And so where I come in, I say, my mission and purpose here is to educate you. And you are the patient. So you will make a decision which direction you want to go. But I want to give you all the tools and information so you make the right educated decision. And then, I can't tell you if you want to go surgical route or injection route or chiropractic route or that route. That's your choice. But
Right.
if I give you the tools, then at least I know that I did my part in educating you in what's available for you.
Yes, which is a powerful position to be in. The form of an educator, I think, is really powerful. And we need that. And I do agree with you. I think, we used to kind of joke about like Google MD, people would Google their problems. But now that we have AI, if you use it correctly, you actually can get access to lots of different resources and studies and information. It's not just, Google spitting out for you what is wrong with you. You can get links to lots of different information, which I think is really powerful. And it helps doctors be able to communicate with patients because they do at least have some knowledge in some sense of what you're talking about as you start to speak to them.
Very true. There's a lot of information. And if you input the right questions, you'll get the right output and it will
Yeah.
really direct you well. Sometimes you have to question it because, sometimes they say that a lot of the stuff out there can, not always true, but for the most part, there's a lot of information out there in the world of AI and, Dr. Google that can
Yeah.
direct you and give you at least. So what it does, it educate the layman's person who does not have any background in medicine so they understand what's going on with them. And then,
Great.
of course, they need to find the right doctor, but at least it gives them like a baseline of what's happening because
Yeah.
the terms can be sometimes very scary.
Yes. Yes. It also helps people with what questions to ask. I think that's also very helpful. So a lot of times you don't know what you don't know unless you ask the questions.
True.
So like I know my dad had ankle surgery and, he didn't necessarily ask all the right questions about what like life was going to be like after the surgery. I was sort of like, how did you not ask those questions? Like you could have asked Chat GPT what questions you should ask for the after part. Like you almost in some ways don't necessarily even have to overthink it. AI will help you have a conversation with a doctor by helping you understand what questions to even ask so that you can get into the right information if the doctor isn't forthcoming with some of that information.
That's true. I had some patients said I have surgery. I'm like, what kind of surgery is that? I don't know. So how can you not know?
Yeah.
Like, didn't
Right.
you ask? Well, they told me that they're gonna do surgery, and I thought that that's what it is. Like, but you need to know. So
Yes.
it's a lot less now than before, but
Yeah.
people are more educated. But there's still some people that just they don't know, but they need to ask.
Yes. You have to become your greatest advocate for your own health.
True.
Because if
Very
not
true.
you, then who? Okay, so before we run out of time, you've shared so much. So thank you for that. I love to ask my guests if there's a book that has impacted you personally or professionally that you would recommend that the listeners and the viewers read. I believe books change lives, and I think it says a lot about my guests based on the book that they recommend. So is there a book that you would recommend to everybody?
So one book that I read recently that I thought was amazing was it's called The Body Keeps the Score, meaning
I've
that
heard of
when
that.
it's a really great read because and I read it because I had a few patients that told me about it because they've been living in chronic pain. And it basically tells you that the body remembers everything. So
Yeah.
when you go through stress or trauma or any kind of hormonal shift or inflammation, it will show up physically. And it's going to tell you that it's going to manifest itself with how you physically feel. And especially with those patients that live in chronic pain, because again, my world is the spine and that's what I hear and that's what I see every day. It's like, why does it not get better? I did everything that I could, and why is it not better? And then when we do a little deeper dive, we discovered that there is like an emotional triggers or some internal trauma that they just energetically cannot release. And, years ago, it was more like a voodoo thing. It was like,
Yeah.
well, it's just very spiritual. But the reality is it's actually true science. If you have some kind of trauma that you hold in your subconscious and you don't let go, you can do everything and anything and you will still keep it. And if that's the most vulnerable part in your body, you will literally feel it. So we need to learn how to clear that out too. And there are treatments for that as well.
Yeah.
But it's very interesting because, I've treated a lot of patients. We've done everything. Their problem is not even that big, but for some reason, they're still stuck to that little pain that doesn't leave them. And then in conversation, you understand that, when you dig deeper, there's so much underlying emotional trauma that they're holding on versus people with severe, scary MRIs and someone that this is a surgical case. How did you even touch this person? How were you even? And they just recover like there's nothing. And it's like, this is just so interesting. It's like a mystery. How can someone like this, that is not very healthy comparing to the next person that takes care of themselves and eat healthy and takes vitamins and all of those things, still have those elements of pain that I cannot get rid of, and someone else with a more serious issue and with less, healthy habits is able to fully recover. And that the differentiating factor is the mental and emotional component and the energy that they keep. And I've seen it many times. And that's why I read that book and I thought, oh my God, that really puts clarity into those issues.
Yes, which is so true because your body remembers. It definitely remembers. Just like your body has the ability to heal, your body also remembers. So I love that book. And you are not the first guest to recommend that book. So I have to read that one. I haven't read it and I definitely need to. So thank you for that. Is there anything that I didn't ask you that you want to make sure you communicate? Did I miss anything?
No, I think that my biggest message is that if you are suffering from any condition like herniated bulging disc, sciatica, any back and neck pain that's persistent, that nothing went away with anything you did, I think it's time to kind of try and look for another alternative and seek out, care that is maybe a little out of the mainstream that nobody ever offered you, but it has to make sense. So we, with the advancements of medical technology, we can achieve great things. And I think that anybody that listens that has pain or any kind of condition that's similar to what I mentioned, there are solutions out there for you. There are options out there for you. You don't have to live in pain. You just have to look for them. You have to do your research, of course, and know that pain should not define who you are. It can definitely change if you just make the change.
Powerful way to end. Pain should not define who you are. Thank you so
That's
much,
true.
Dr. Rozenberg. It has been a pleasure to meet you. It's been fascinating to learn about your practice. I will put everything in the show notes so that people can follow you. They can go to your website. They can learn more. They can even travel out to California if they'd like. Beautiful LA, get some sunshine and get some healing. It would definitely be worth the trip over surgery, in my opinion. So I thank you so much for your time, and we will definitely stay connected as things evolve. I'd love to hear about it.
Thank you for having me. And if they want to find me, our centers are called spinatomycenters.com. And we have 3 locations in the LA area, right next to the airports.
So convenient. Perfect. Thank you so
Yes.
much. And we'll put all of it in the show notes as well. So people don't even have to go and write it all down. They can just look on the notes and they can find you. So thank you so much. I hope you have a beautiful day. And thank you again. Thank you for joining us for this week's episode of Building the Best You. If you are ready to take a deeper dive into transforming your life, check out my Empowerment Fundamentals course on my website, houseofgermar.com. Thank you, and I will see you next week with another inspiring guest.